Good morning. I am Dr. Ashish Sabharwal, urologist, andrologist and robotic prostate surgeon. I am director of Blue Ribbon Prostate Clinic, New Delhi. Today I will tell you the pre-surgery and the post-surgery care for penile implants. The main issue about penile implant is the risk of infection, because penile implant is a foreign body and we are placing in an area which is prone to infection. If the implant gets infected, then we have to remove the implant and the whole surgery is wasted. So we have a very specific schedule how we take care of the patients before surgery. Firstly, we will do all the urine routine, urine culture. We will examine the local skin. There should be no local infection. And we will give pre-operative antibiotics, levofloxacin 500 mg once daily. Along with that, we instruct the patient to start betadine scrub bath for at least 3 days prior to the treatment and take it daily, every day, 2 times a day, morning and evening, for 3 days before surgery. On the day of surgery, we do part preparation, that is, we shave the pubic hair in preparation for the penile implant surgery. This shaving should be done only on the operating table. It should not be done before surgery. During the surgery, there are some specific steps which we take. These steps help in preventing the infection post-operatively. Firstly, we use the 10-minute scrub technique. What the 10-minute scrub technique means? The doctor, the assistant, both scrub their hands before surgery for 10 minutes. The body of the patient is scrubbed by betadine scrub for 10 minutes before starting the surgery and before painting and draping. This makes the body sterile. Secondly, I always do this surgery, the first case, in the morning when the OT is sterile, the operation theatre is sterile, and we do not have had any other surgeries before it, because previous surgeries will leave some infection. The operation theatre is fumigated overnight to make it absolutely sterile. We do swab cultures almost daily, every week of the theatre, to make sure there is no harboring infection inside the operation theatre. Then intraoperatively, we use the no-touch technique. What the no-touch technique means, that we totally seal off the incision site from the rest of the surrounding skin. This is done by IO-band drapes, which are placed on the skin, and we cut and make the incision across the IO-band drape. So the only part where we cut opens up, rest of the part is all sealed from the scrotal skin. Thirdly, once we have made the spaces and we are about to place the implant, we use the Malkahe technique, in which we do thorough antibiotic washings of the penis and the scrotal area and the incision site and inside the corpora, so that there is no chance of any infection getting onto the implant. During surgery, we take care of the proper hemostasis, we stop any bleeders, and after surgery, we leave a drain. All these things prevent in having any hematoma, collection or infection. After surgery, we keep the patient for 2 days in the hospital. We give them IV antibiotics to prevent against infection, and we give scrotal dressings every day. Along with the scrotal dressing, we keep the whole scrotal wound compressed so that there is no space available for the hematoma to develop. Also, once the patient is more conscious, we tell him to use ice packs to keep the area cold, so that there is no hematoma which develops inside the scrotum. We keep the patient under close monitoring for at least 7 days after the surgery, so that we are sure there is no infection developing. If there is a malleable implant, after that patient does not need to follow up, and after 1 month he can start his intercourse. If it's a 3-piece inflatable implant, then it is deactivated for 3 weeks, and after 3 weeks we activate it, and once it is activated, patient can start intercourse after 1 month. So these are the few steps how we prevent infection and have excellent results in our penile implant surgery. Thank you.